Hello friends, I am Dr. S Aditya. I am an interventional cardiologist practicing at the Yashoda Hospital, Hyderabad branch. Today I would like to share some insights into the topic of sudden cardiac death. Sudden cardiac death is an unexpected death that follows an abrupt cessation or a stoppage of cardiac function. The definition extends to include deaths that occur within 1 hour of the onset of symptoms. The symptoms preceding sudden cardiac death include chest pain, shortness of breath, palpitations, lightheadedness, sweating, and nausea. It may be emphasized that sudden cardiac death also can occur without symptoms preceding the event. The impact of sudden cardiac death are profound at the emotional level, at the personal level, and at the society level. So it is important for all of us to develop an awareness on this subject and see what we can do to decrease the impact or decrease the mortality burden of this event. A variety of etiologies are described to cause sudden cardiac death. The most important being coronary artery disease, that is blockage to vessels that supply blood to the heart. Apart from this, a wide variety of genetic, muscular, and ion channelopathies have also been implicated in sudden cardiac death. Apart from this, electrolyte imbalances, that is disturbances in the salts levels in the blood, and certain drug or toxin abuse could also lead to sudden cardiac death. Whatever may be the preceding event, the sudden cardiac death is a result of an abrupt cessation of rhythmic cardiac contraction, which we call as ventricular fibrillation. The onset of this catastrophic rhythm leads to loss of purposeful ejection from the heart and thereby collapsing the entire blood supply to the vital organs of the body, especially the brain. Unless properly attended to, sudden cardiac death is a catastrophic event, and our ability to deliver resuscitatory measures as soon as possible determine the outcome, that is survival. Prompt initiation of cardiopulmonary resuscitation by trained bystanders has been shown to improve survival outcomes in these patients. Apart from that, the other important step of resuscitating a patient is to deliver a DC shock. So wherever available or wherever they are available, the automatic implantable cardioverter defibrillators that are being used across airports, railway stations, and in all public places, if the shock is delivered at an immediate time, the chance of survival in the hospital also improves. Not only this, once we have managed the acute phase or the immediate primary aid to the patient, it is important to shift the person to a well-equipped medical center. So this in itself is a CRM or a crew resource management which will allow for prompt delivery of therapy. Once the shock is delivered and primary CPR is done, it is important that we shift the patient to an appropriate medical facility where advanced care can be provided, such as angioplasty or correction of various metabolic disturbances. It is important to have situational awareness at this time and look at what all available resources are there or help that we can get, so that one can access medical facilities by communication. At the same time, other person would be delivering CPR effectively. Prevention of sudden cardiac death involves identification of risk factors which could lead to sudden cardiac death. Importantly, as we have already discussed, it is the coronary artery disease which is the predominant cause of sudden cardiac death. So it is important to identify people who could be at risk of having coronary artery disease, such as diabetics, smokers, patients with abnormal cholesterol levels, and also have periodic health checkups wherein these disturbances can be observed and appropriate therapies can be given. Apart from that, a detailed family history is important, especially in those families where these events have occurred in other family members, because some of these genetic conditions which involve diseases of the heart muscle or channelopathies can be transmitted from one generation to another. A detailed genetic analysis also helps in some of these patients in preventing sudden cardiac death. It is also observed that significant number of sudden cardiac death events occur during exercise and hard work. So people who are interested or would like to participate in competitive sports or would like to take part in heavy exercises as a part of a profession or hobby it is recommended that they undergo a cardiac evaluation before they undertake these exercises. Apart from that, it is also important to keep things in moderation, even exercise also, and not resort to excessive or very strenuous exercises which may sometimes precipitate a cardiac event. It is observed that heart operates best at moderate levels of work and not in the extremes. So it is important that when somebody is participating in an exercise or a sport, they have a cardiac evaluation before they undertake the same. It is my recommendation that people have awareness about the risk factors that could lead to sudden cardiac death. Also, sufficient number of people getting trained in basic life support, that is the ability to deliver cardiopulmonary resuscitation, and also as a public health measure have AICDs or defibrillator devices at as many points as possible to improve the survival following a sudden cardiac death. It should be remembered that a prompt initiation of cardiopulmonary resuscitation, defibrillation and immediate medical care will help prevent large-scale deaths and will help to reduce the impact of sudden cardiac death on our society. Thank you.